I'm Rick Jones. I work at the University of Leeds and I've been helping organise this conference on pathology IT systems. IT is central to the delivery of pathology. The one product of the lab is information, and IT has a role at all stages of laboratory practice. Even when clinicians are asking for tests, often now requests are sent in electronically. Inside the labs, the systems are all run on IT systems with lots of robotics and complex systems, and the majority of the data now leaves the lab in electronic format, and that has to reach the clinical users of the laboratory services who are dealing with the patients. So IT is involved in every stage of laboratory activity. My top hopes of the summit are that we actually get a really good consensus between the service providers, the industry who provide our systems, and the NHS policymakers who have to fund and run the services. So my hope is that by having a very open discussion between those multiple stakeholders, we can reach a consensus and move forward as to what the next phase of development needs to be. I think one is to understand the business model of pathology and how that's changing, so who the customer is. In the past, I think we've been focused on the production process of lab tests and lab results. Nowadays, I think we have to move much more into the value chain and understanding what this means for clinical practice and the patient at the end of the chain. So that's one. So one of the challenges of that is to really recognise that new model. I think we also have to understand that a lot of our systems are now antiquated and need replacement, and there's a large cost involved in making that change. But if we don't make the change, I don't think we can evolve much further with some of our systems. And I think the third challenge relates to the staffing levels in pathology. Pathology's been under serious cost-cutting pressure for quite a long time. And one of the things that's suffered is the numbers of staff who are left behind to support systems. We've had many retirements of people who were involved in putting systems in maybe 20, 30 years ago, and the new staff don't necessarily have the same interest in IT and in running systems. So I think there's a need to professionalise still further the IT support involved in the laboratory. I'd like to finish really and say that I think it's very encouraging, the level of debate that's happened at this conference, and we've had international visitors, we've had industry here, we've had research interested groups here, and the level of interest has really been, very kind of rewarding output of this conference, and one hopes it will actually influence the future.